Treatment for arthritis in hip will help with several types of hip arthritis, including osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and post-traumatic arthritis. There are many types of hip arthritis and each have their own unique causes. The most prevalent cause is deterioration in the hip joint that occurs naturally with advancing age. Pain at or near the hip joint is one of the most common symptoms of hip arthritis, along with stiffness, audible clicking sounds when moving the hip, and weakness. Deterioration of the cartilage that lines the hip joint is what we mean when we talk about arthritis in the hip. The ball of the hip joint is located at the top of the thigh bone, and it is surrounded by a socket, the femoral head. Cartilage acts as a barrier between the ball and the socket, also known as the acetabulum. When the leg moves, the cartilage functions as a slick layer between the ball and the socket, which enables the ball to glide and rotate without friction. Stability is provided by the labrum, which is a thick cartilage that lines the rim of the socket, around the hip joint. Damage to the cartilage in the hip can cause the joint to become rough. As cartilage deteriorates, the space between the bones becomes more constricted. When the condition has progressed to its advanced stage, bone will rub against bone, and even the slightest movement can cause discomfort and stiffness. When there is friction at any point between bones, it can also lead to the development of bone spurs, which are growths of bone that can be found on the margins of a bone and cause it to change shape. The term degenerative joint disease refers to osteoarthritis, which is a disease that gradually deteriorates the hip joint over time. It is the most prevalent form of arthritis that affects the hip, and it can also affect the joints in other parts of the body. Osteoarthritis of the hip is almost always brought on by the deterioration that comes with aging, and it only becomes worse with time. When cartilage breaks down, it can cause discomfort and inflammation in the body. Because of the uneven shape of the bones that make up the hip joint, osteoarthritis of the hip may progress more quickly in some persons. For instance, if the ball and the socket of the hip joint don't completely fit together, a condition that results in hip impingement, they may rub against each other, which can eventually lead to osteoarthritis. Hip impingement is one of the conditions that can cause osteoarthritis. People who have hip dysplasia have a hip socket that is too shallow to accommodate the ball of the femur. Hence, this condition can occur in these individuals as well. Because of this, unnatural tension is placed on the cartilage, which accelerates the rate at which it deteriorates. This in turn causes the individual to seek treatment for arthritis in hip. Symptoms of arthritis in the hip. The symptoms of hip arthritis may be persistent or they may come and go. The following are common symptoms of hip arthritis. Hip pain that can be made worse by specific motions and exercises. The pain can be felt anywhere in or near the hip. Cartilage degrades at a different rate in different areas of the body. And if a particular action places stress on an area that already has greater damage, the patient will experience an increase in pain. Pain from osteoarthritis of the hip is typically localized in the groin, but it can also be felt in the outer thigh and the upper buttock region on occasion. Pain may become more severe after prolonged durations of standing or walking, as well as following extended periods of relaxation, waking up in the morning. Hip stiffness makes it difficult to move the hip and can also make it difficult to twist the leg. Because of this, it could be difficult to perform daily chores like putting on socks and shoes. When a damaged hip is moved, a sound similar to cracking, clicking, crunching, or breaking can be heard. This sound is known as crepitus. Hip weakness is typically the outcome of engaging in less physical activity. Because of the pain, arthritis in the hip may drive you to move less, which in turn makes the joint even weaker and worsens the symptoms. Arthritis of the hip and its risk factors. Age. If you are of a certain age, there is a good chance that the cartilage in your hip joint has become worn down. A surplus of weight. The hips are subjected to greater strain when a person is overweight or obese. Injury. An injury of significant severity, such as a broken hip or a tear in the labrum, might result in arthritis many years later. Overuse. Occupations and sports that demand physically repetitive motions that put stress on the hip can raise a person's chance of getting osteoarthritis of the hip. Gender. Postmenopausal women have an increased risk of developing hip osteoarthritis compared to males of the same age. Women are more likely to be diagnosed with rheumatoid arthritis than men. Structural or developmental abnormalities. Hip dysplasia and impingement are two conditions that can cause the bones that constitute the hip joint to have an irregular shape. This can cause the cartilage to experience abnormal stress. Autoimmune triggers. Although researchers have not been able to determine what causes rheumatoid arthritis or psoriatic arthritis, they are making progress in their efforts to identify the factors that set off inflammatory disorders. Psoriasis, for instance, is thought to have an infectious component as one of its potential causes. Genetics. It's possible that certain autoimmune diseases that contribute to arthritis in the hip run in families. Other conditions related to health. The risk of developing osteoarthritis is increased in individuals who also have diabetes, high cholesterol, hemochromatosis, high levels of iron in the blood, and a deficit in vitamin D. There are treatments for arthritis in hip available. That, despite the fact that hip arthritis is typically a chronic condition, can help lessen the symptoms and limit additional damage. Surgery, such as hip replacement, can provide long-term relief for your deteriorating quality of life. There is more than one way to treat arthritis in the hip, and the approach that is taken is determined by the patient's age, as well as the severity of the condition. It is possible to treat the illness with procedures that do not involve surgery, surgical procedures, or a combination of the two. The initial phase of treatment for hip arthritis consists of reducing overall body weight, reducing the amount of physical activity one participates in, taking anti-inflammatory medication, and maybe getting hip injections. Shedding pounds can also assist in lowering the amount of pressure that is placed on the hip joint. People who suffer from this condition could find some relief if they refrain from engaging in activities that make their agony worse. A significant negative effect on a person's quality of life can be caused by hip pain and stiffness. Surgical intervention might be helpful for certain patients. There are two surgical approaches that can be taken to treat osteoarthritis of the hip. 1. A procedure that involves the resurfacing of the cartilage in the hip. During this procedure, the damaged area of bone on the femoral head is removed by trimming or shaving it. The point at the top of the thigh bone that fits into the hip socket is termed the femoral head. After the damaged portion of the bone has been removed, the surgeon will then cover the femoral head with a metal cap. In addition to this, the surgeon will place a metal cup into the socket of the hip. 2. Surgical reconstruction of the hip. During this procedure, the femoral head as well as the socket are both replaced at the same time along with the hip joint. They are then substituted by components made of metal, plastic, or ceramic by the surgeon. Every possible surgical approach comes with its own set of benefits and drawbacks. A doctor would typically take their patients through all of the available options before settling on a course of treatment to prescribe. The good news is that today, you have access to the best resources and guidance you require. So managing your arthritis does not have to be any longer a tough process for you. Simply follow the link below this video to find the most effective treatment for arthritis in hip. Click the link now.